Thank you, Madam Chair. I appreciate you recognizing me. Today, I'm honored to speak on a very important piece of legislation. This resolution is personal, this resolution is critical, and this resolution is timely. The resolution recognizes that race is a social construct, an institutional and structural bias that have resulted in racial disparities that affect individual and population health, social, economic, and educational outcomes. I thank you so much, Madam Chair, for your unwavering support of moving forward with this resolution. I must say that Dane County continues to work to improve our policies, our procedures, and our processes, and to use racial equity and social justice lens when we do so. We have just started. We have so much more work to do to break down the institutional structural racism that negatively affects so many people in our community. Dane County continues to be a leader, a champion at equity and inclusion, criminal justice reforms, and health initiatives. This resolution continues to move us one step closer to reducing our unacceptable disparities that exist and inequities that exist all across the lifespan of a person, especially African Americans. A growing body of research shows that racism is a social determinant of health. In Wisconsin, the highest death rates exist for African Americans and Native Americans at every stage in the life course. And the infant mortality of non-white Black women is the highest in the nation. It is unacceptable. Public health in Madison and Dane County continues to focus their work on health equity and the root causes of poor health outcomes by addressing the social and economic forces that affect the health of our community. Several public health Madison and Dane County initiatives specifically addresses the impact of race on health outcomes. There are several I'm going to mention because I want you to understand the great work that has happened so far. Breastfeeding community collaboration teams that increase breastfeeding and pumping access across county through lactation rooms, micro grants, directly funded and partnering with 3 organizations of color around racial inequities and breastfeeding. Fetal and infant mortality review leadership is a partner in Dane County Health Council in their work with reducing Black infant mortality, including partnering with the Foundation of Black Women Wellness. Licensed establishment created a sliding scale for inspection fees so that small businesses would be less burdened by the fees. Food security experts work with the Park Street community to preserve food security on Park Street when Pick and Save, many of us heard that conversation, was going to close. And the closure of this grocery store would have had a disproportionate impact on families of color. Violence prevention was part of the community safety intervention team, which responds to violent incidents and works to prevent violence and retaliation. Sexual and reproductive health hired a bilingual disease intervention specialist to better serve Spanish speaking folks in our community. Nurse family partnerships and prenatal care coordination worked on quality improvement around safe sleep services and shifted messaging to focus on the risk and reduction, a way of implying any blame or shame. Black babies are more likely to die before age 1 than white babies in Dane County. That should not be acceptable. That cannot be the norm. And finally, develop of a person of color affinity group that is being facilitated by the YWCA Madison in an effort to create a safe environment for public health Madison Dane County. I'm honored to say that I have been on this board over 14 years, moving really critical initiatives. Tonight, I'm going to ask each of you as my colleagues to join me on standing up and saying that race is a public health crisis. There is so much more we can do, but this is the absolute best start to continue to build the relationships that are necessary in order to change the outcomes of so many people. I thank you so much, Madam Chair, for your leadership, all of my colleagues. Thank you, Supervisor Gray, for your inspiration. It might have not been the inspiration people wanted, but it was truth, it was power, and it was authentic. And for that, I commend you for that. On tonight, I'm going to ask for a roll call because I really want to know where you stand in your beliefs, where you stand in addressing racism as a public health crisis. And thank you all so much. I look forward to this continuous journey over this 2-year term when we change true outcomes in Dane County. Thank you, Madam Chair.
Thank you, Supervisor Stubbs. Is there further discussion on Resolution 106? Seeing no further discussion, roll call has been requested, and the clerk will call the roll.
Okay. Gray.
Aye.
Gray, aye. Hazel.
Aye.
Hazel, aye. Hatcher. Hatcher, absent. Jors.
Jors, aye.
Jors, aye. Kiefer.
Kiefer, aye.
Kiefer, aye. Kilmer.
Elmer, aye.
Kilmer, aye. Krause.
Krause, aye.
Krause, aye. Levin.
Levin, aye.
Levin, aye. McCarville.
McCarville, aye.
McCarville, aye. McGinnity.
McGinnity, aye.
McGinnity, aye. Miles.
Miles, aye.
Miles, aye. Peters.
Peters, aye.
Peters, aye. Peterson.
Peterson, aye.
Peterson, aye. Ratcliffe.
Ratcliffe, aye.
Ratcliffe, aye. Rip.
Rip, aye.
Rip, aye. Ritt.
Britt, aye.
Ritt, aye. Rusk.
Rusk, aye.
Rusk, aye. Shower.
Shower, aye.
Shower, aye. Schwellenbach.
Schwellenbach, aye.
Schwellenbach, aye. Smith.
Smith, aye.
Smith, aye. Stubbs.
Stubbs, aye.
Stubbs, aye. Veldrin.
Veldrin, aye.
Veldrin, aye. Wegleitner.
Wigleitner, aye.
Wegleitner, aye. Atkins.
Adkins, aye.
Atkins, aye. Andre.
Andre, aye.
Andre, aye. Audette.
Audette, aye.
Audette, aye. Bear.
Bear, aye.
Bear, aye. Baird.
Baird, aye.
Baird, aye. Bollig.
Bollig, aye.
Bollig, aye. Chavla. Chavla, absent. Chenoweth.
Chenoweth, aye.
Chenoweth, aye. DeGarmo.
DeGarmo, aye.
DeGarmo, aye. Doolin.
Doolin, aye.
Doolin, aye. Downing.
Downing, aye.
Downing, aye. Doyle.
Doyle, aye.
Doyle, aye. Erickson.
Erickson, aye.
Erickson, aye. Eicher.
Aye.
Eicher, aye. Aye.
35 aye. Thank you. Resolution 106 passes.